Good evening, everyone, and a warm welcome to our annual members meeting. My name is Martin Havenhand, and I am the chairman of the Rotherham NHS Foundation Trust. We are holding our annual members meeting online again this year. This is because over the last 2 years, we have had more members of the public watching the recordings of our annual members meeting online than we ever had attending our face-to-face annual members meetings. Last year's recording has been viewed hundreds of times, which is obviously good news for us. Because the meeting is virtual, you also have the opportunity to ask any questions you have during the meeting by clicking on the Q&A button at the bottom of your screen. This meeting is our annual opportunity to reflect upon the achievements of the last financial year 2021-22 and to present a report on our performance to members, governors, partners and the population of Rotherham. Our agenda for this evening will start with our Chief Executive, Dr. Richard Jenkins, who will discuss our successes as well as the challenges we faced and how we responded to them. In addition, he will discuss our performance in relation to patient outcomes and mortality. And later in the agenda, he will also describe our plans for the future. We will hear from our Chief Nurse, Helen Dobson, about how we have worked hard to provide high-quality, safe care for our patients, despite the challenges posed by the ongoing pandemic. Sally Gilgareth, our Chief Operating Officer, will provide more detail of our operational performance during the year. Steve Hackett, our Director of Finance, will report on the Trust's financial performance during 2021-22, and our external auditors will describe the findings of their annual audit of the Trust's financial statements. Stephen Ned, our Director of Workforce, will share with us the work we have been doing to support and engage our colleagues during the year, including our Reciprocal Mentoring programme, which I am proud to be a part of. Our Deputy Chief Executive, Michael Wright, will describe how we work with our partners across the Rotherham Place and the South Yorkshire Integrated Care System to improve the health outcomes of our local communities and tackle the inequalities which have been laid bare by the pandemic. Our lead governor, Mr. Gavin Rimmer, will describe the changes to the Council of Governors over the past year. During the last 12 months, there have been a number of changes to the Board of Directors, and Gavin will introduce our 2 new non-executive directors, and I will introduce our new executive directors. As chairman, I know that our most valuable resource is our workforce, so I would like to begin this evening by saying thank you. Thank you on behalf of the Board of Directors to our incredible colleagues who have yet again shown tremendous dedication and resilience during another challenging year for the Trust and for the NHS as a whole. I mentioned that we had appointed a number of new executive directors during 21-22. Steve Hackett joined the Trust as our Director of Finance in July last year, and Angela Wenzika became our Director of Corporate Affairs in September 2021. In October 2021, our Chief Nurse, Angela Wood, was seconded to the NHS England, and we welcomed Helen Dobson back to the organisation to serve as Interim Chief Nurse. Following a competitive recruitment process in April this year, we were delighted to announce that Helen had been appointed our Chief Nurse on a substantive basis. On the 1st of September this year, Dr. Richard Jenkins was appointed our Chief Executive on a substantive basis alongside his existing role at Barnsley Hospital NHS Foundation Trust. His appointment is supported by both Council of Governors. This partnership will benefit both trusts and build on the close relationship we have developed over the years. Sharing knowledge and experience between the 2 trusts has been immensely valuable, particularly over the last 2.5 years. Earlier this month, our Medical Director, Dr. Callum Gardner, left the Trust to take up his new position as Chief Medical Officer at North West Anglia NHS Foundation Trust. Callum had been our Medical Director for 4 years and played an important role in our response to the pandemic and improving our mortality rates. We wish him every success in his new role. Mrs. Susan Douglas has been appointed our interim medical director for an initial 3-month period while we recruit substantially. Susan is a consultant in ear, nose and throat surgery and is our deputy medical director. 2021-22 was again a year dominated by the COVID-19 pandemic. The requirement to rapidly respond to changes in infection rates challenged our services, but our dedicated colleagues found ways to adapt and we were still able to make progress with our recovery plans. During these challenging times, it is important that we support our colleagues' well-being, and we have focused on initiatives designed to help them maintain both their physical and psychological health. We have provided psychological support, healthy lifestyle courses, and also we've introduced Thunder, the therapy dog, who has done sterling work visiting colleagues across the Trust who have greatly enjoyed his boundless energy and enthusiasm. The Rotherham and Community Charity, with support from our local community and the national fundraising efforts of Sir Captain Tom, has been able to provide grants to develop outdoor areas designed for the well-being of our patients and our colleagues. The Trust has continued to work with our local partners, Rotherham Borough Council, RDASH, Voluntary Action Rotherham, and our GP colleagues to deliver the Rotherham Place Plan, along with our wider partners across the South Yorkshire Integrated Care System. NHS South Yorkshire and the Integrated Care Board became statutory bodies on the 1st of July this year. Working collaboratively across the system is now the way forward, and the South Yorkshire and Bassetlaw Acute Federation has been formed and was formally established on the 1st of April this year. The Acute Federation is the Acute Provider Collaborative for South Yorkshire, consisting of the 5 acute trusts. Looking to the future, we launched our new 5-year strategy in December 2021, which we have called our New Journey Together. The strategy sets the Trust's priorities and includes the learning we have taken from the changes made in response to COVID-19. It provides a new direction for the Trust as the country emerges from the pandemic and returns to a new normality. I do hope that our annual members meeting gives you a real insight into the last 12 months for our organisation. And don't forget that you can ask a question through the Q&A button at the bottom of your screen. I'm now going to hand over to our Chief Executive, Dr. Richard Jenkins.
Good evening, I'm Dr. Richard Jenkins and I'm the Chief Executive of the Rotherham NHS Foundation Trust. The last 12 months have been challenging for the Trust and the wider NHS, especially in relation to the new Omicron variant of COVID-19. Our colleagues have yet again shown dedication, innovation and resilience in the face of the continuing pandemic to provide high-quality care to patients and families. During both of the 2 major COVID-19 waves in the last year, the Trust was one of the most affected organisations nationally in respect of the proportion of our beds being used by patients with COVID. Unfortunately and inevitably, this reduced our ability to treat other patients. The Trust worked closely with our partner organisations to focus on dealing with these pressures, particularly in relation to the safe and timely transfer of patients out of the hospital environment once they were medically fit to do so. We continue to focus on patient flow throughout the year using our new command centre, embedding the Safer Care Bundle and rolling out the new national Right to Reside indicators across the Trust. We faced the challenges together as a team and managed to deliver a number of achievements. We created a new division of therapies, dietetics and community care in April 2021, which has led to greater visibility of the great services provided in these specialties and the colleagues delivering them. The partnerships with other organisations across the system are strong and productive and have developed in year due to our commitment and investment. We've reduced the number of cancer patients waiting more than 62 days for treatment. We've won national recognition as the only organisation in the local area to receive Nat Digital aspirant funding. And we are one of the top 10 trusts in the country for elective recovery performance. We've adapted and changed our ways of working to continue to provide safe and effective care. The organisation returned to delivering a balanced financial position. Staff engagement has been a key priority for us, so the 2021 National Staff Survey results provided a measure of the progress we've made in this area. We achieved a higher response rate than previous years and higher than the national average. The aggregate scores across the whole survey placed us second out of the 4 South Yorkshire acute trusts and 4th out of the 12 Yorkshire and Humber acute trusts. But we know there's more we can do. We've also made investments in our estate to improve patient experience. This has included a new Discharge Lounge that opened in June 2021. We've also partnered with Accessable, which is a charity aiming to improve the accessibility of services for visitors and colleagues. We replaced over 300 windows to improve patient and colleague comfort and also to reduce our energy consumption. We've refurbished the Keppel ward and undertaken development and refurbishment aimed at improving staff well-being. For example, we've implemented a well-being garden, a woodland walk and upgraded staff restrooms. We've continued to focus this year on improving our mortality performance. At last year's annual members meeting, we reported that the impact of the pandemic on our mortality data meant that it was difficult to see the benefits of the work we'd undertaken to improve our rates. At that time, our mortality rates were still above the national average. This year, I'm pleased to say that it's clear that our efforts are resulting in a reduction in our mortality rates. The Mortality Improvement Group, established during the last financial year, has delivered the impact we anticipated by reducing our hospital standardised mortality ratio, also known as HSMR, and a key mortality indicator, to now being within the as expected range, and it is continuing to fall. This means that our HSMR rates are now below the national average. The data as at February 2022 showed our HSMR was 98.3, whereas the average level is expected to be 100. This is the lowest rate for 4 years. In fact, the HSMR data for the last financial year evidence a sustained downward trend. The other important mortality indicator is the summary hospital level mortality indicator, and that also includes deaths within 30 days of hospital discharge. For January 2022, this was 107.5, and this is also within the as expected range. We continue to work hard to analyse our mortality data, to undertake deep dives into any areas of concern and identify key actions we need to take related to these themes and trends. These actions are designed to drive improvement around the 3 Cs: care quality, case mix, and coding. Whilst we have made some significant achievements over the last year, there are a number of areas where we recognise that we have challenges we still need to overcome. In May and June 2021, the Care Quality Commission, also called CQC, inspected the urgent emergency care services, medical care, maternity, and also children's and young people's services. It also undertook a separate well-led inspection. Whilst we were disappointed overall to remain as requires improvement, there was evidence of clear improvement both in the narrative aspects of the report, and also we were delighted to see our maternity services recognised as being good. We're determined to build on these improvements through the next year to deliver exceptional care to our patients. Our elective activity had to be reduced for most of the 2021 to 2022 years because of the ongoing impact of COVID-19. This meant we also saw an increase in our waiting lists as referrals increased back to levels seen before the pandemic. Despite the improvement in our mortality rates, we know that we need to improve the way we share learning from deaths across the entire organisation. So a programme of work focusing on our quality governance structures and processes has been undertaken and is underway to support this improvement going into the next year. We continue to proactively engage with the national Get It Right First Time programme, which enables us to compare key outcome data across a variety of clinical areas with national data in order to drive further improvements in both the quality of care we offer, but also the efficiency in how we deliver that care. In September 2021, the Trust refreshed its 5-year strategy, and this was approved by the Board of Directors. It was created after significant engagement, in fact about 500 engagement sessions with colleagues, patients and partners across Rotherham. This strategy provides us with a foundation for our future development, and I'll tell you more about it later in the meeting. In conclusion, I'd like to say a number of thank yous. The first goes to our dedicated and committed colleagues and governors, without whom we could not have achieved what we have done in this challenging year. The second goes to our incredible volunteers who worked extremely hard to provide practical support to our patients and their families when we were unable to allow visitors to our inpatient areas due to national restrictions as a result of COVID-19. And finally, I would like to thank the Rotherham Hospital and Community Charity for its support to our colleagues and patients with wellbeing packages. As Martin mentioned, I'm delighted to have been appointed as substantive Chief Executive at the Trust. I look forward to being able to continue to work with the Board of Directors, the Council of Governors, our colleagues, members and volunteers to further improve the quality and responsiveness of the care and experience we offer to our patients and their families.
Hello, I'm Helen Dobson, Chief Nurse. Patient experience is a key priority for the Trust, and we have made some positive improvements in the last year. We strive to deliver person-centred care to help us achieve the best possible outcome for our patients. We have placed a bigger focus on effective ward rounds and discharge planning. This is supported by our integrated discharge team with colleagues from the Trust and Rotherham Metropolitan Borough Council coming together to form a single point of access for all complex discharges. We recognise the importance of improving flow through the organisation and have made a number of improvements to the way we identify planned discharges, ensuring we maintain daily oversight of our position regarding patients who are medically fit to be discharged out of the Trust. This means we are focused on getting patients home or to onward care in the community when they are ready. In 2021, we opened our new Discharge Lounge, providing modern clinical facilities for patients as they await discharge from hospital. Our community services continued to see increased activity across adult and children's services. The team ensured patients in need were seen as soon as safely practical, and in a number of areas have continued to implement new ways of working. In March, we extended our visiting times so patients can be with their loved ones from 11 in the morning until 8 in the evening, 7 days a week. We know that visitors are partners in care, and we want to make it as easy as possible to visit loved ones. In recognition of the importance of carers being able to support their loved ones, we have pledged to support John's campaign, which actively welcomes flexible visiting for carers of patients with dementia. Throughout the COVID-19 pandemic, we have had to implement various infection prevention methods. Unfortunately, at times, this has meant restricting visiting. This was never an easy decision to make, as we understand how important it is for patients to be able to spend time with loved ones. Whilst visiting restrictions were in place, we implemented a relatives line to facilitate medical updates for patients next of kin. This ran alongside our virtual visiting facility. Patient engagement is vital in helping us to improve our services, and this year we introduced monthly public panels. These events encourage patients, carers and the general public to feed back their lived experience of hospital and community services, covering a range of topics from patient information to living with long-term conditions. We will be looking to build on this going forward with the introduction of focus groups. The Care Quality Commission carried a routine inspection in May 2021 of 4 core services: urgent and emergency care, medical care, maternity and services for children and young people. In addition, a well-led review was conducted in June 2021. A further inspection took place in March 2022 as a follow-up on progress against the action plan for urgent and emergency care. Our overall rating remains as required improvement. It was noted, however, that there have been improvements since our previous inspections, but there is still work to be done. We have been working on the necessary improvements since the inspection and continue to make progress against the comprehensive improvement plan developed in conjunction with each core service. Finally, I would like to thank colleagues for continuing to put patient care at the forefront and for their hard work over the last year. Their dedication to patients and to supporting each other makes me incredibly proud. Thank you.
Good evening, I'm Sally Kilgarriff. I've been the Trust Chief Operating Officer since May of this year, having previously been the Director of Operations and Deputy Chief Operating Officer here at the Trust. I'd like to explain in more detail how the Trust performed against some of the key national metrics. For the second year in a row, there were no patients who waited longer than 12 hours in urgent and emergency care once we had decided to admit them. We continued to participate in the national field test of the new urgent care metrics, which are reported separately through NHS England. Patient flow has been a key area of focus for the last year as we work to increase the efficiency of discharges and aim to consistently discharge patients across all 7 days of the week. As the prevalence of the pandemic has reduced, we've been able to relax some of our infection prevention controls, which should help us to simplify emergency patient pathways going forward. Across our community services, we saw increased activity as part of our efforts to care for people closer to home and out of acute hospital settings. To respond to this increased demand, a number of community teams established different ways of working. The children's team experienced different pressures during the year, especially in relation to the availability of Tier 4 children's and adolescent mental health beds. The shortage of these beds, both nationally and within the local area, meant that a number of patients stayed on our paediatric wards when they would normally have been treated at specialist NHS organisations. Our teams adapted their ways of working to support these patients. Throughout the COVID-19 pandemic, we prioritised those in urgent need of care. Unfortunately, as seen nationally, this has had a significant impact on our waiting lists. We experienced a 70% increase in the number of patients on our waiting lists in 2021-22 as demand for care bounced back after the lockdowns. About 30% of this increase was as a result of a change in the way waiting lists are reported nationally, ensuring we also include patients who have been referred but not yet booked appointments. With our partners in the South Yorkshire and Bassett Law Integrated Care System, we took part in the National Accelerator Programme between July and September 2021. This meant we were able to deliver increased levels of elective activity due to the additional investment provided. As a result, the number of patients who had waited over 52 weeks for treatment came down from around 600 at the end of March 2021 to less than 100 by the end of March 2022. By July of last year, we were delivering 85% of treatments within the 18-week standard. However, the operational pressures during the autumn and winter and a further wave of COVID-19 meant that this performance reduced to 75% by March this year. National guidance during 2020-21 meant a significant reduction in some of our key cancer activity. During 2021-22, our focus was on reducing the backlog of patients who were waiting for cancer treatment and returning to pre-pandemic levels of delivery. Unfortunately, we were non-compliant with the 62-day standard for patients with cancer to be treated following urgent GP referral. However, we were identified as being one of the top performing trusts nationally, both in terms of the recovery of our cancer activity and the way we responded to the increase in cancer referrals during 2021-22. A key focus for us in 22-23 is returning to compliance with the 62-day standard. In 22-23, a new faster diagnosis standard will be introduced. This means that suspected cancer patients will receive a diagnosis within 28 days of referral. To prepare for this, we analysed areas of the cancer care we provide, particularly where performance was below that of comparative trusts. We reintroduced straight-to-test diagnostic pathways, which had a significant impact. We improved our performance against the new standard from less than 65% to over 75% by the end of the financial year. When it comes to diagnostic waiting times, the national standard is that no more than 1% of patients should wait longer than 6 weeks for their diagnostic test. Whilst we consistently met this target pre-pandemic, the impact of the pandemic on our capacity meant that we did not deliver this standard. During 21-22, however, we saw a significant improvement in our performance against this standard compared to the previous year, and we remained the highest performing trust nationally for endoscopy throughout the year. In early 2022, we were really pleased to see a second MRI scanner installed at the Trust, which will help us to meet demand for diagnostic tests. As we move forward into 22-23 and a return to a more normal way of operating, there are still a number of key areas for improvement. This includes reducing the waiting times for patients in our urgent and emergency care centre. The national focus is to reduce the number of patients waiting more than 12 hours in the department. We have a programme of work focusing on patient flow throughout the organisation and maximising safe and effective discharges for our patients. This work encompasses clinical leadership, emergency pathways and other internal operating models. As we gradually come out of the COVID-19 pandemic, we know that it's critical that we continue to support the health and well-being of our colleagues who have experienced some of the most difficult working conditions in the NHS's almost 75-year history. I would like to take this opportunity to thank all our colleagues and volunteers for everything they've done over the last 2 years to provide high quality care for the people of Rotherham.
Hello everybody, my name's Steve Hackett, Director of Finance here at the Rotherham Foundation Trust. It's my responsibility today to give you some headline numbers for the financial year 21-22 and to give you some idea of the successes that we've had over the last 12 months within the organisation. Before I start, I would like to give a big personal thank you to all colleagues in the organisation that have contributed to the success of the Trust throughout the year ending 22. We've made some massive strides forward in terms of being able to improve our efficiency in the organisation. And without the support of colleagues, clearly we wouldn't have been able to do that and impact on the delivery of patient care in the way that we have. So thank you very much for the contribution that you've made over the last 12 months. In the financial year that we've just finished, the Trust, along with all other NHS organisations, faced some huge challenges around reorganising our planning footprint and going through multiple cycles of planning rounds as we went through the various waves of COVID-19. And so it's a great personal thank you to my team for working with clinical colleagues, working with the divisions to actually set financial plans throughout the year as we were reacting to a number of different allocations by the NHS. So it's a great personal thank you to my team for working with clinical colleagues to make that a reality and adjusting work programmes as we went through the financial year. Without the success, without the cooperation of the divisions working with my team in finance, then we wouldn't have been able to make the strides that we had in the last financial year, setting us up in terms of our position going forward as an organisation. The Trust performed well in this financial year 21-22. We exceeded our financial plan, which is the second year in a row that we've been able to do that. So we're making really strong foundations going forward for the organisation. So in terms of our income and expenditure position, we exceeded our financial plan at the year end by around about £1 million. In addition to that, we spent just over £15 million in capital resources, so improving the estate of the organisation, investing in medical equipment and investing in IT infrastructure. One of the most significant projects that we were able to deliver in the financial year ending 22 was the installation of our new MRI scanner. It's really impressive and we're really proud to be able to get that new MRI scanner installed and operational. I'm pleased to say as well that the Trust finished the financial year with a strong cash balance, and that will support our organisation going forward into future financial years. Having said that though, the Trust does face challenges going forward into the future. We're no different to any other NHS organisation, but clearly we have demands on the resources that we have, increases in energy prices, increases in materials that we buy as part of our estate are all going to impact in the ability to deliver sustainable services going forward. So it's really important that we all work collectively together and use the financial resource and human resource that we've got to the best effect, making sure that every interaction with patients counts and we can deliver as much patient care and as much quality care as possible for the population that we serve. So I'd just like to say thank you again on behalf of my team, on behalf of the board, for the success in terms of the financial year 2021-22. And I look forward to working with you to make sure that we can provide sustainable services going forward to the population that we serve. Thank you.
Hello, my name is Stephen Ned, Director of Workforce here at Rotherham NHS Foundation Trust. Caring for our colleagues remains a key focus for us, particularly as they continue to face some of the most challenging times in the history of the NHS. We have implemented a number of initiatives to support the health and well-being of those working at the Rotherham NHS Foundation Trust, including team visits with Thunder the Therapy Dog and the launch of the Healthy Eating, Healthy Mind, Healthy Body programme. We have also invested in wellbeing facilities, refurbishing and developing staff restrooms and grounds and gardens across the hospital site. We've also engaged a new occupational health provider with input from the Trust Disability Staff Network to ensure that the needs of disabled employees were taken into account when designing the revised service. The service delivers high-quality interventions to employees, supporting a healthier, fitter workforce. The pandemic has placed an enormous amount of pressure on staff, and we encourage our colleagues to look after themselves and each other. Our updated version of our People Pack includes the links to a variety of wellbeing support available at local, regional and national level. Our people are our biggest asset, and listening to our workforce ensures we can respond to concerns, understand the challenges faced by teams and implement changes to improve working conditions. There was a wonderful response rate to our 2021 National Staff Survey, with 60% of colleagues taking the time to provide feedback. Despite the ongoing challenges seen throughout the NHS, the Trust maintained its position amongst peer organisations. Out of a total of 117 questions, 92 were scored positively. We recognise that we must continue to engage with colleagues to drive improvements and build on the progress we have already made. We value the opinions and experience of colleagues and understand the importance of working in partnership with the entire workforce as we move forward. When developing the Trust's new 5-year strategy, a large number of engagement and stakeholder sessions were held across the organisation to enable maximum input. Last year, we were proud to launch the Reciprocal Mentoring programme, which provides opportunities for individuals from underrepresented groups to work as equal partners in progress with senior executive leaders. Understanding each other's lived experiences creates awareness, insights, and actions which help us create a more inclusive organisation. We currently have 26 people taking part in the programme so far, and we'll look to build on this going forward. Despite the challenges presented by the pandemic, we recognise that valuing and celebrating the achievements of our workforce is essential to enable the growth and development of the organisation and the individuals who are part of it. In November 2021, we ran our annual Proud Week to acknowledge staff achievements. The week included a recognition of learning event to celebrate our colleagues who completed any form of learning, training or personal development in the previous 12 months, as well as a long service award to celebrate those who reached the 25 and 40-year milestones. The week culminated in a virtual Proud Awards ceremony, which was an opportunity to recognise individuals and teams within the Trust who consistently go above and beyond to deliver outstanding care and support to patients and colleagues.
Hello, my name's Chris Edwards. I'm the Deputy Chief Executive of the South Yorkshire Integrated Care Board, but I'm also proud to be the Executive Director for the Rotherham Place as well. Just to explain what the new integrated care system is we refer to ourselves as NHS South Yorkshire, but we're legally called the South Yorkshire Integrated Care Board. We started as a partnership in October 2018, but we became a statutory organisation on the 1st of July this year, following about a change brought around by the 2022 Health and Care Act. So the principle of an integrated care board and an integrated care partnership is it's a partnership of local authorities, the NHS and the voluntary sector working across our neighbourhoods and places across South Yorkshire through our provider collaboratives. So as we became established on the 1st of July, the clinical commissioning groups that were previously were abolished at that date, and we took on the responsibilities of the clinical commissioning groups and some other additional delegated responsibilities from NHS England. Our key role is to work as a key partner within the South Yorkshire system to collectively deliver health and care services that meets the needs of the South Yorkshire population. We work closely alongside our councils, NHS partners and the voluntary sector to address health inequalities and also to try and tackle the wider determinants of health. Our 4 places include Barnsley, Doncaster, Rotherham and Sheffield. Our new website was launched on the 1st of July, which you can visit via the address below. So, just moving on to the purpose of our organisation, we've got 4 key objectives, and that's to improve the outcomes in population health and healthcare, to tackle inequalities in outcomes and experience and access of services, to enhance productivity and value for money, and also a new duty to help the NHS support broader social and economic development, so we work across the wider sector to really look at all the determinants of health. So I'm just going to give a quick system overview of our South Yorkshire health and care system. So in our system we have 36 neighbourhoods across our 4 places, we have an ambulance trust, we have 8 acute and NHS hospital trusts, we've got 3 community and mental health trusts, 4 unitary local authorities, and 72,000 members of staff across our organisations. We manage a budget of £3.9 billion across health and social care. All this is overseen by our board. So our board membership is just coming up on the slide now. We have an independent chair and non-executive members, as you would on a normal statutory board. But what makes us different is we have the executives, such as a chief finance officer, a chief medical officer, a chief nurse, a chief people officer, and a director of strategy and partnerships. But what makes our organisation different is we have additional members. So we have 4 executive place directors for each of our 4 places. And we also have partner members, which cover the wider membership of the ICS. So we have a local authority partner member, we have a public health director as a partner member, we have a mental health trust partner member. In addition to that, we also have a member from the voluntary and community sector, the acute trust sector, and primary care, which is a GP from Sheffield. Healthwatch also sit on the board, but they wish not to be a member to keep their independence, but they're a very active participant in our meetings. Our first board meeting was held on the 1st of July as we adopted the new organisation and its statutory responsibilities, and we meet in public every other month if anyone wants to view our meetings. The next slide shows an overview of the ICB governance structure. And what this shows is we have the Integrated Care Board, which we've just described, but we also have an Integrated Care Partnership, which is where all the wider partnership across South Yorkshire sits, and that's where our key strategy is formed. And then the Integrated Care Board is charged with delivering the strategy. As you'd expect, moving from left to right on the slide, we'd have the normal assurance committees you'd associate with a statutory organisation. But again, what makes us different is each of our 4 places have statutory committees, which will take on a significant delegation of resources. We also have system delivery groups, which cover a range of areas, but some of the key things in the policy which we'll really focus on are digital, people and sustainability. Obviously, quality, population health, finance and estates will be key agenda items as well for us. And the final part is the collaboratives. So we've formed collaboratives in South Yorkshire. So we have collaboratives across mental health and learning disabilities and autism. Our acute trusts have a very well-established provider collaborative. We have a newly formed primary care alliance working across all our GPs and wider primary care, including dentists, pharmacists and optometrists. We have a collaborative across our voluntary sectors across our 4 places as well. In addition to that, we have children and young people, cancer, urgent emergency care and maternity collaboratives. In Rotherham, we've been working in a collaborative way since 2016. We probably, you could say, we're a bit ahead of the national strategy and the national policy. We've got an extremely well-established way of working, and what we've done is we promote joint working and integration where it makes sense to do so. What this change in terms of the national policy will do, though, will move this to a statutory footing and we'll expect to take on delegated responsibility for significant resources. We do intend to transform the way we care for people and achieve a positive change for the Rotherham population. We do have a track record of developing and delivering new solutions, and we're passionate about providing the best possible services and outcomes for our population. We're committed to a whole system partnership approach, as only through working together can we provide sustainable services over the long term that aim to help our population live well for longer. The Rotherham Place has strong and robust governance. As I said, we've been meeting since 2016 and we've developed this governance over that time. All the governance includes all partners as equal members, and we make sure that lay members and non-executives are fully engaged in our processes. We agreed our place vision and principles in 2018 and we've refreshed it twice since then, in the light of the change in South Yorkshire and also as post-pandemic. Our third plan was agreed in 2020 and progress on delivery was reported to the Place Board and subsequently to the Health and Wellbeing Board, which again is a meeting that in Rotherham. 3 transformation groups, 6 enabling groups, all reported through the delivery team and then through the Place Board, trying to improve services for Rotherham patients. And so what's in store for the future for South Yorkshire? Well, our ambition is to continue to establish and formalise the new organisation, the South Yorkshire Integrated Care Board. As I said, we'll refer to the organisation as NHS South Yorkshire. We'll keep developing its governance arrangements and its partnerships to continue to try and meet our objectives. Also in the future, we want to continue the close working and further develop the close working with system partners to address immediate priorities. We do have significant challenges facing us at the moment. We have the cost of living crisis. We were heading for a very difficult winter as infection rates for flu and COVID may well be high as well. So we want to work together to address immediate priorities, but also keep working on our long-term goals to improve population health. Also, as part of the Integrated Care Partnership, we want to make sure we develop an integrated care strategy across South Yorkshire that all partners are fully signed up to and we can deliver it to improve population outcome for the people of South Yorkshire.
Hello, my name is Michael Wright and I'm the Deputy Chief Executive for the Rotherham NHS Foundation Trust. The disproportionate impact of the COVID-19 pandemic laid bare the health inequalities within our society, and as a result, the entire NHS is now focused upon understanding the causes of these inequalities and working to mitigate them. This evening I will describe the work the Trust has undertaken over the last year to understand the inequalities experienced by our local population. I will also talk about the way in which the Trust is collaborating with our partners to address these inequalities going forward. When we talk about health inequalities, we mean the unfair and avoidable differences in people's health across the population and between different groups within that population. The World Health Organization notes there is a great deal of evidence that social factors like education, employment status, income level, gender and ethnicity have a distinct effect on how healthy a person is. The lower an individual's socio-economic position, the higher their risk of poor health. As Chris Edwards explained, the Trust is part of both the South Yorkshire Integrated Care System, or ICS, and Rotherham Place. Recent research revealed that our ICS is the 4th most deprived ICS in the country. As we know, the lower socio-economic position of a person, the greater their chances are of experiencing poor health. So for our ICS, reducing health inequalities is crucial. There is work going on at both the ICS and place level looking at health inequalities. However, as a Trust we wanted to have a dedicated internal focus on this issue, so we established a Health Inequalities Task and Finish Group which met for the first time in October 2021. The aim of the group was to identify and prioritise key actions to reduce inequalities in care outcomes. The first piece of work the group undertook was to analyse the data we had to understand the issues impacting on the Rotherham's population access to health services. Here are some of the things we discovered from our analysis. Firstly, patients from certain GP practices in Rotherham are more likely to attend our A&E department. There were no significant differences in the average length of wait based on patient levels of deprivation. More than half of the referrals received by our family health, medical and surgical services were for people who lived in one of the 4 highest areas of deprivation in Rotherham. When we looked at the patients who did not attend their outpatient appointments, we noticed that patients from the most deprived areas were twice as likely not to attend their appointments as those from the least deprived areas. Having analysed the data, the Task and Finish Group decided that the following 6 key actions should be prioritised to reduce inequalities in outcome from care. Firstly, implement a waiting well programme for patients waiting for surgery. Secondly, personalise our care to respond to patient needs. Thirdly, undertake a data analysis deep dive to better understand specific areas of inequalities in access. within the trust and identify appropriate resolutions. Fourthly, to focus on the expansion of our preventative activities, such as our Quit smoking cessation programme, and identifying gaps which could be filled by secondary care provision. Fifthly, develop a programme of support for staff to reduce health inequalities across our population, including financial assistance, support for colleagues. And finally, drive forward our work as an anchor institution, including the agreement of an anchor charter. The Board of Directors is committed to delivering on this programme of work during 22-23 with our partners across both the Rotherham Place and South Yorkshire ICS. I provide an update on the progress at both the ICS and the Rotherham Place level to each of our public board meetings, so you'll be able to see how we take forward the health inequalities agenda over the coming year. If you would like to know more about the ICS, the ICB or Rotherham Place, please visit the website of the ICS, ICB and Rotherham Place, which are listed on the screen. Thank you.
Hello, my name's Gavin Barker and I'm an Audit Director with Mazars. I'm also the Engagement Lead on the audit of the Rotherham NHS Foundation Trust. Mazars are the Trust's independent external auditors, and the main areas of our work are to give an opinion on the financial statements, to review the arrangements you have in place to ensure economy, efficiency and effectiveness in the use of your resources, which is also known as our value for money work, and also to report to National Audit Office as part of their audit of the group accounts of the National Health Service, on the consistency of the consolidation schedules that you're required to submit with the audited financial statements. The audit of the financial statements for 2021-22 went smoothly this year. The Trust produced draft financial statements on the 26th of April 2022, and the statements produced were of good quality, as was the working papers and the evidence underpinning those financial statements that we considered as part of the audit. We feel as though we had a good working relationship with the teams at the Trust, and we had the full cooperation of management, and we're certainly grateful for the assistance that was provided to us as part of our work. There was no significant issues in relation to the financial statements audit, and we were able to issue an unqualified audit opinion on the 20th of June 2022. That opinion was that the financial statements presented a true and fair view of the financial position of the Trust at the 31st of March 2022 and of the income and expenditure for the year, that the financial statements were properly prepared in accordance with the Department of Health and Social Care Group Accounting Manual, and also that they were properly prepared in accordance with the requirements of the NHS Act 2006. As part of our work on value for money arrangements, there are three key areas that we consider: financial sustainability, governance, and improving economy, efficiency, and effectiveness. We're required to report significant weaknesses where we identify them and recommendations in relation to those weaknesses. We don't underestimate the challenges facing the NHS in general and the Foundation Trust, and we make our comments in that context. In the previous year, 2020-21, we identified three significant weaknesses and recommendations arising from issues that emerged at the Trust during 2019-20 and that were being tackled during 2020-21. We're pleased to report that the issues that we'd identified in the previous year in relation to governance and financial management were fully addressed by the Trust, and that is no longer an area of significant weakness for us to report. Similarly, the Trust was able to carry out sufficient work to ensure that the NHS improvement licence conditions in relation to financial planning were lifted during the year. So again, that is another area where there is no longer a significant weakness for us to report. We noted the results of the Care Quality Commission's full inspection of the Trust, which was reported in September 2021. The overall assessment requires improvement, but there was considerable positive comment in the report on the actions being taken by the Trust to address the issues that existed, and also indicated to us a positive direction of travel, while not underestimating the issues that still need to be addressed. We have reported one significant weakness in relation to the 2021-22 audit, and that does relate to Care Quality Commission findings. And that is in relation specifically to the Section 31 condition on the Trust's registration, which was still outstanding in 2021-22, although positively we do notice that that condition was removed on the 9th of May 2022. But because it existed during the financial year that we're reporting on, 2021-22, we still have to report that as a significant weakness. There was one other area that we reported on in relation to our value for money work. This wasn't a recommendation arising from a significant weakness. It was an area that we thought was important for the Trust to focus its attention on. And that related to the efficiency targets, the very challenging efficiency targets that the Trust has during the current financial year, 2022-23. We noticed at the end of June 2022 that the Trust reported that there was a significant level of unidentified efficiencies at that point. So it's clearly important for the Trust during the remainder of 2022-23 to develop its plans in relation to those efficiencies and to monitor their delivery very closely. And that's the recommendation that we've made in our report. On the conclusion of our work on the financial statements and our work on value for money, we were able to issue the audit certificate on the 25th of August 2022. The audit certificate formally closes and concludes the audit, and we were able to do that at the end of August. That's all I wanted to say. Thank you for listening.
Hello and good evening. As Lead Governor, it is once again my privilege to briefly respond on behalf of the Council of Governors to the annual report for 2021-22. The NHS and the Trust continue to face challenges going forward, as you have heard, not least because of the aftermath of and the continued recovery from COVID-19. This last year has also seen the NHS prepare for and begin the transition to new arrangements that will have a big impact on how and where the people of Rotherham receive their care. The Council of Governors believes that the solid platform laid and the prudent management of the Trust by the senior leadership team, coupled with the continued dedication of all NHS colleagues, will stand Rotherham in good stead for the rest of 2022-23 and beyond. 2021-22 was a period of financial recovery for the Trust. The recovery continued through prudent financial management, and we were very happy to see the substantive appointment of Steve Hackett as Director of Finance in July. The financial situation is one the Governors will continue to monitor closely throughout this year during our continued recovery from COVID-19 and through the challenging times ahead for the NHS in terms of winter pressure in particular. That being said, a return to financial balance in 2021-22 was an excellent outcome for the Trust and was welcomed by the Council. The Care Quality Commission visited again in May and June with mixed results, and the overall status of requires improvement was disappointing. The Council are aware that the newly appointed Chief Nurse, along with all colleagues, is working tirelessly to embed practices that lead to our overall improvement. In December, we launched our new 5-year strategy, which sets out the key strategic ambitions for patients, Rotherham, our partners, us in the Trust, and the overall delivery. The governors were regularly consulted, informed and listened to during the development of the strategy, and we hope to see it bear fruit over the next few years. Last year, the Council of Governors interviewed and appointed 2 new substantive non-executive directors in Dr. Joe Bibby and Mike Killick. We also, for the first time, appointed an associate non-executive director to the board, Cameron Malik. In September, after Mike Killick's resignation, we were delighted that Cameron agreed to take on the role of non-executive director. Public governors have an important role in representing the voice and the diversity of the local community, and also influencing the continual improvement of health services for the people of Rotherham. A full Council of Governors means we can fulfil that role and meet our statutory duties much more effectively. Recently, it has proven difficult to elect enough governors to fully achieve this. In 2021-22, we managed to elect 1 new governor and co-opt another. So the Trust has agreed to hold mid-term elections this year during November, with the aim of bringing more public and staff governors to the Council. So if you're a member of the public or of the Trust and are interested in improving the health of Rotherham and representing fellow Rotherham citizens, please do consider standing in the elections. Finally, the Council wants to take this opportunity to once again pay tribute to everyone who works for the Trust and all of the other NHS staff in Rotherham for their dedication and hard work, their compassion and their resilience. Without them, the NHS could not function, and we really appreciate everything that they do. Thank you and good night.
Earlier in the meeting, I talked about how the last 2 years have undoubtedly been the hardest the Trust and the NHS as a whole has ever faced. While thankfully cases of COVID-19 have reduced, we're still facing tough challenges as a result of the pandemic. As more normal operations resume within the NHS, we will focus our energy on returning to pre-pandemic levels of delivery of services and performance. Tackling waiting lists is a top priority for us, and we're working very hard to reduce the waiting times for people needing operations or procedures. Our colleagues have shown incredible dedication to help us recover, but whilst we are proud of the progress we've made so far, we know we still have a long way to go. We understand how difficult it can be when you're waiting for treatment, and we're determined to shorten waiting times as soon as we can. We are looking to embed a quality improvement approach to our day-to-day work throughout the organisation. This will ensure that we are able to constantly learn and improve our processes. Our 5-year strategy looks to the future and builds upon what we have already achieved. It takes into account that the future is about system working rather than individual organisations, and recognises that people are our most valuable resource. It commits us to ensuring we have the right people with the right skills to deliver high-quality services. Patient safety and the quality of care we provide remain top priorities and are at the heart of everything we do. We've taken a number of steps to improve our CQC rating, but we know we have more work to do. We have a comprehensive improvement plan in place to help us build on the progress already made, and we look forward to working closely with the CQC over the coming year to sustain this momentum. The demand on our urgent and emergency care pathways has been challenging. We know that patients have experienced long waits in our urgent and emergency care centre, and our aim is to improve this. We will continue to focus on how we manage flow through the organisation. The Trust has launched a much broader and significant programme of work to sit around this, which includes a focus on clinical leadership, emergency pathways and our internal ways of working. We've seen a number of wider changes throughout the NHS, particularly with the new integrated care agenda, which, as you've heard, has seen integrated care boards replace CCGs and encourages collaboration and partnership working. We already have strong working relationships with our partner organisations across South Yorkshire, and this change will see us build on that, allowing us to work together more effectively for the benefit of the people we serve. As you know, my role has become substantive, and I will continue my joint role as Chief Executive for the Rotherham NHS Foundation Trust and Barnsley Hospital Trust. Sharing knowledge and experience between the two trusts has been immensely valuable over the past 2.5 years, and we will continue to work closely to share best practice and to support each other where we can. The pandemic has changed the way we work, and although we cannot predict how COVID-19 will impact us in the future, I'm very proud of the commitment shown by my colleagues and how they continue to give their all for the people of Rotherham.